The patient has been placed in supine position with arm in the anatomical position on an arm board. Use your non-dominant hand to gently palpate the radial pulse proximal to the insertion site. The pulse is found lateral to the distal end of the flexor carpi radialis tendon. Ensure at this stage that Allen's test is performed to check collateral perfusion of the hand. Place a towel under the arm and reset the forearm to the anatomical position. Swipe to select the swab roll. Place the roll under the wrist to put it in dorsiflexion. Swipe to select the antiseptic swab. Use the antiseptic swab to sterilize the area around the radial pulse. It is best practice to apply the sterilizing solution in concentric circles. Place the drape proximal and distal to the sterile area. At this point, a small amount of lidocaine can be administered for comfort of the patient. Place the drape proximal and distal to the sterile area. At this point, a small amount of lidocaine can be administered for comfort of the patient. Swipe to select sterile gauze. Place the gauze distal to the pulse. This is to catch any overflowing blood from the needle insertion. Swipe to select the catheter and needle assembly. Use your dominant hand to insert the needle at a 30 to 45 degree angle to the skin, directly above the pulse. Slowly advance the needle until pulsatile blood flow is observed. The pulse is used as guidance. If there is no blood return, withdraw the needle and reattempt using a different trajectory, or use the ultrasound machine to locate the artery. Continue to advance the needle through the vessel. Swipe to remove the needle. Stabilize the catheter using your non-dominant hand. Slowly withdraw the catheter until pulsatile blood flow is observed. Swipe to select the guide wire. Advance the guide wire through the catheter until its distal end has passed the catheter tip into the arterial lumen. Reducing the needle angle to approximately 10 degrees can facilitate guide wire passage. Advance the catheter over the guide wire and into the arterial lumen. Ensure the base of the catheter hub is at the skin. Remove the guide wire from the artery carefully, leaving the catheter in place. Confirm pulsatile flow through the catheter. If there is no flow, insert the guide wire into the catheter and reposition the catheter by slowly withdrawing until flow is seen. Swipe to select the transducer system. Attach the catheter to the fluid-filled tubing of the transducer monitoring apparatus. Confirm a good arterial waveform on the monitor. Swipe to select a 4-0 non-absorbable suture. Secure the arterial catheter into position using sutures. Swipe to select a sterile dressing. Apply sterile dressing over the catheter site.